I am Moritz Fürstenau from the German CLL study group. I'm also a medical doctor at the University of Cologne in Germany. And together with the global PI, Barbara Eichhorst, I'm coordinating the GAIA or CLL13 trial, which is a phase 3 multicenter study investigating different time-limited venetoclax combinations in the first-line treatment of patients with CLL, and the primary endpoint was reached about 1.5 years ago, and the primary efficacy manuscript was already published back then, and we now just recently published a 4-year follow-up of this study in the Lancet Oncology, where we now had a closer look at the differences in efficacy between the different venetoclax combinations, and we also had a closer look at follow-up second-line treatments, toxicities, and so forth. The GAIA study is quite a large study that was run in multiple sites, multiple countries in Europe and in Israel, and we had 926 patients included in total. Was a patient population compared to other CLL populations that's rather fit and rather young, with a median age around 60, and patients with TP53 aberrations were not included in this study. So primary endpoints were progression-free survival and undetectable MRD rates. And in the primary endpoint analysis, we already found out that the Venetoclax obinutuzumab combination and the Venetoclax obinutuzumab ibrutinib combination, which is not approved yet, were both more efficacious in terms of progression-free survival compared to the chemoimmunotherapy arm. And what we looked at now in the follow-up analysis was the differences between the venetoclax arms, and what we found out was that both the venetoclax obinutuzumab doublet and the venetoclax obinutuzumab ibrutinib triplet were more efficacious or were associated with longer progression-free survival compared with the chemoimmunotherapy arm, but also the venetoclax rituximab arm, which was the third combination we investigated. And what we especially looked at were differences between the doublet, which is approved, venetoclax obinutuzumab, and the triplet, which is not approved. And we saw that the curves, the PFS curves, separate, but did not, or the difference in PFS in the general study population was not significant. But looking at the subgroup of patients with a unmutated IGHV, so a higher risk CLL, these patients particularly benefited from the addition of ibrutinib to this doublet. However, the triplet combination, which seemed more efficacious in this subgroup of patients, was also associated with more toxicities, especially infectious adverse events, cardiac adverse events, hypertension, and also bruising and so on. So ibrutinib-related adverse events. The overall survival was not different between all the arms, so we didn't see any overall survival signals at this time point. Regarding clinical implications, I'd say the study gave us the information we were looking for to also use venetoclax obinutuzumab in this rather fit patient population, because we see it's safe, it's very efficacious, and it gave us hints that it might be worth investigating the triplet combination in a rather high-risk patient population, because in this patient population we looked at the moment, the potential benefit we see was rather marginal compared to the venetoclax obinutuzumab arm, and it was, the triplet combination was associated with more toxicities. So at the moment we wouldn't really recommend this triple combination for the treatment of this patient population we investigated it in.